Good evening, everyone. Welcome to our second Health at Home talk. My name is Andrew Asano. I serve as the CEO of Susan G. Komen, Oregon and Southwest Washington affiliate. And I hope each of you, as you're logging on, are able to get technology to work for you. We are so excited to be here with you again. This is our second one. It was a beautiful day today. I hope all of you could at least see the beautiful day, and perhaps if you're able to get out and enjoy some of that fresh air. It's a wonderful evening to be together, and we thank you for spending time with us. I am so excited. Without further ado, I'd like to get right into the discussion. I have a wonderful guest that I have come to know over the past several years, and I know she has many fans on the discussion this evening that we will likely hear from. Dr. Nathalie Johnson, a breast surgical oncologist at Legacy Health, is with us here today, and she also has served as a former board director for Komen and is a wonderful advisor, friend to us, and supporter. And it's just a delight to, I personally get the chance to speak with her tonight and join her as she helps us through tonight's topic of support, surgery, and survivorship in this time that we live in. So without further ado, Dr. Johnson, welcome to the Health at Home Talk.
Thank you. Thanks for having me.
I hope you were doing well and your family's doing well.
Yes, we are. It's, trying in unusual times, but as we were saying earlier, there's always silver linings.
There are. We were talking about that just a few minutes ago. You have to find the positive and the things that make you smile together, especially as we spend much time together in isolation.
Yes.
So on that topic, Dr. Johnson, so many of us, we are in professions where we can work from home and we are with our families and our pets and talking to our neighbors from the sidewalks. You, of course, as a healthcare provider, are on the front lines, and you continue to be an essential person in the continuum of care. So to get right to it, how has your approach to care shifted with the introduction of the COVID-19 pandemic?
So we've had to really think through, trying to keep people safe. But also to make sure that the people that need to come in are seen so that we can take care of them, because illnesses like cancer and other things go on despite COVID. So thinking about which patients we can do video or phone visits, we're doing that. On the other hand, there's some people that we need to feel their breast or see their incisions or talk to them in person, and we're having them come in. Of course, we're using precautions. Some of the things that we've done too is for our own staff and ourselves is to try to pair up so that we don't have two doctors in the office at the same time, and we try to work with the same staff so that if somebody became COVID positive, we wouldn't take out the whole office, so that we would still have providers to care for our patients.
So are you seeing yourself and others in your practice doing more telemedicine?
Yes, definitely. We are doing more telemedicine, both phone and video.
Are you finding with your own patients that there are surgeries that you're having to postpone? And if so, what kinds of surgeries?
So I just want to go a little bit back, and it's always nice to have a little lighten the mood a little bit when we're going through these things. So one of the challenges I think with video visits and breast is it just feels weird to show your breast on a video camera.
Yeah, I bet.
So we have.
I hope it's a closed channel.
You want me to do what? We do use secure networks.
Okay, I was going to ask that. That was my next question. So for our viewers, you're okay if Dr. Johnson and other doctors are asking you to.
Yes, everybody's using HIPAA compliant, secure sites. Okay.
We can always count on you to bring the laughter to something so serious. So you're seeing your surgeries still moving forward as scheduled with the patients that you have.
Now, actually, not all of them.
Okay.
So what the Surgeon General asked us to do was to focus on urgent surgeries and to stop elective surgeries, and mostly because they're really worried about the PPEs, they're called, or personal protective equipment. So mask and gloves and gowns, so that there's enough for the people who are on the front line taking care of actual COVID patients. And so they've instituted some protocols for safety. And for that reason, because there's a shortage, they've asked us not to do electives. So in the world of breast, some of the surgeries are not urgent, so to speak. For instance, people who have estrogen positive breast cancers, many of them can be placed on what we call neoadjuvant endocrine therapy, or we put them on tamoxifen or one of the aromatase inhibitors, and that actually treats the cancer. The cancer will shrink, and so they can stay on that for 6 months to a year. In Europe, sometimes they do 18 months of this neoadjuvant endocrine therapy. So as long as you're monitoring and you're making sure that the tumor is responding and getting smaller, it is safe for those patients to wait. Some of the benefits of that are some of them, you don't bring them into the hospital where they may be exposed to COVID. So they are able to delay their surgery until later. So that's one of the upsides.
Thank you. It really answers my next question that I'm sure viewers would be asking, and that is, you obviously answered what might cause the surgery to be postponed and whether it should worry them. But there's so much vetting and understanding of why you would make that choice, such that there shouldn't be worry by the patient if in fact that were to be the case.
Yeah, and there are some tumors where you need to have chemotherapy. And in that situation, then we would go ahead and place a portacath, and so that patient could go on and start their chemotherapy.
I think one of the questions that has come up in the past is that if a patient's treatment or surgery is postponed, a patient might be wondering, is their cancer going to grow, or would it be more difficult to treat by the time they do go in for the rescheduled procedure? That's probably a complex question to answer.
Well, it's sort of multifactorial. So it would really depend on the type of breast cancer you have. So if you have an estrogen positive breast cancer that's responding to endocrine therapy, then actually your tumor will be getting better or getting smaller while you're waiting. On the other hand, if you have a triple negative breast cancer, then it's not good to delay, and that you should be on some treatment, either chemotherapy or, if it is appropriate, straight to surgery. So that would be somebody that would be considered an urgent case, and they would go on. If you're HER2 positive, then again, usually you would be starting on chemotherapy. Now, here's where it's really, I think, important to stick with the timing of surgery, is that we do have some patients who have been undergoing chemotherapy and are finishing their treatment. And there's a window of safety to do their surgery. So I think 3 to 4 weeks is the outside window that you should do surgery coming off of chemotherapy. We actually, our group did a study. Dr. Garreau, who you know well, was the lead on that. And we looked at our patients and their outcomes based on their timing to surgery. So if they had finished chemo and they had surgery within 3 to 4 weeks, they had the best outcome. 4 to 6 weeks was the next best, but there was a little drop off, and greater than 6 weeks actually really decreased the person's overall outcome. So we really feel strongly that if you're coming off of chemotherapy, then your surgery should be done within 4 weeks, and definitely no later than 6 weeks.
Thank you. Thank you. For patients for breast cancer patients, what do you recommend to them in terms of their family situation? Should they be isolating from their loved ones to protect themselves from exposure? What protocols would you suggest? Uh,
So I don't know that they need to isolate themselves from their loved ones per se. For instance, if somebody's over 60 and you have grandchildren that may bring COVID to the house, then you probably should stay away from them. People that are living with you, if you think that they have exposure, if they have to be out and about and they're, for instance, working in a medical field where they may have exposure, then you should definitely try to isolate or use precautions with them. If otherwise they don't seem to be at risk, or like yourself working from home and haven't had exposure, then it should be okay.
I know, as you and I were speaking earlier, this new world of isolation and thinking about uh, during this pandemic and post-pandemic, how we interact with each other, and what are ways where we can keep ourselves healthy just in general times. But the ability, just the isolation is a very difficult thing. I think many people are experiencing, and the fear of not knowing, am I asymptomatic that I could carry it and give it to somebody else, or is somebody in front of me infected and will they pass it to me? And especially with people with compromised immune systems. If you're just joining us for our health talk at home, we are with Dr. Nathalie Johnson, breast surgical oncologist at Legacy Health, who's here to talk about support, surgery, and survivorship. So again, thank you, Dr. Johnson, for being with us. We do have some questions that are being asked from the community that were posted earlier today. And I want to take this opportunity to encourage you, if you are viewing with us, to submit a question if you have one for Dr. Johnson, who would be happy to answer those once we go through a few of the questions that have been posted. So you can do that there on Facebook, and our wonderful manager of this Facebook live show, because Nathalie and I don't know how to do this. She makes us look good, and she will be reading those questions off once we get through a few of the questions that have been posted. So I want to go to the Komen family questions. These are from viewers that are tuning in right now. This one comes from Marianne, and Marianne's question is, what is your opinion, Dr. Johnson, on post-cancer patients drinking alcohol, say once or twice a week at most? People are joking that this is the time to grab your wine and drinks because everyone is stir crazy and we're binging on our comfort foods. She has completely avoided alcohol at all because she read that it can increase the chance of reoccurrence. However, it would be nice to have a drink from time to time. By the way, you were my surgeon, and I loved everything about you and your amazing ability to care for me as a person, not just a patient. You are an amazing doctor and human being. Thanks especially for singing Amazing Grace to me as I went under my surgery during my double mastectomy.
Oh, wow. Oh, well, thank you. And actually, a little wine or an alcohol is okay. Everything in moderation. So if you were to have a glass of wine or two, it's okay and doesn't increase your risk of recurrence. There's a lot of concern about alcohol before breast cancer, increasing your risk for getting breast cancer. But once you've had it, having a glass of wine or two, wine, a glass is, a little glass, not huge, is okay. And actually probably good for your heart as well, because it helps you to relax. So enjoy. And much love to you.
Thank you, doctor. And I'm sure Marianne was happy to hear that. This question comes from Cynthia. How safe is it going to the hospital for a mammogram? It has been 10 years since my breast cancer, and Dr. Johnson was my surgeon. I was scheduled for my routine annual mammogram right when the coronavirus first started in mid-March, excuse me. I was a little nervous, so I rescheduled to mid-May, as that was the earliest I could reschedule. Will it be safe to go to the hospital then?
Yes, it is. And, right now the hospital is really doing a great job of screening everybody, the people that work there as well as visitors, to checking temperatures and symptoms. So I feel like, it's a safe thing to do. And by May, I really feel it should be better. On the other hand, if you're feeling uncomfortable at this point, I think it would be also safe to bump your mammogram out even a little further, because in all likelihood, you're doing fine. And you just want to make sure you get your screening, within the year, but being a few months late is okay.
And that would make sense to make sure that we're not tying up essential resources for those perhaps who are symptomatic and really do need to push up in annual screening.
Exactly.
Yeah, thank you. Julie has Julie has 3 questions. Julie's first question is, does our history of cancer affect our overall long-term health and immunity, particularly vis-a-vis the novel coronavirus?
Say that again.
Does our history of cancer affect our overall long-term health and immunity, particularly vis-a-vis the novel coronavirus?
So that's a great question. The American Society of Clinical Oncology actually put out a statement about the history of cancer and risk and immunity with coronavirus. So if you have had cancer, it does make you a little bit higher risk if you actually get COVID, but you're not more likely to get it than anyone else. It's just that your ability to fight the infection may be a little bit diminished. And I think that may be more important if you've had chemotherapy and other things that may have impacted your white blood cell counts, because some people never really regain full, the level of their white cell counts after they come off of treatment. So that may make you a little bit more susceptible. And then the other things that are make everyone else susceptible, like high blood pressure, diabetes, having lung disease, those things. So if you have a history of cancer, plus you have any of those things, you really want to be careful and make sure you're really washing your hands, not touching your face, and, social distancing.
Those other chronic conditions that you may be living with that affect your immunity as well. In case you're joining us just recently, my name is Andrew Asano. I proudly and gratefully serve as the CEO of Susan G. Komen for this affiliate, and I'm talking with Dr. Nathalie Johnson of Legacy Health, who's sharing some of her evening with us after a long day's work to answer questions within our breast cancer community. Julie's next question asks, does a history of extensive radiation treatment with late effects still in evidence potentially increase vulnerability to the virus or the difficulty in dealing with it after exposure or infection?
So the answer to that, Julie, would be, I don't think any more than the same factors we just discussed, like chemotherapy and so forth. So yes, it just having walked through significant cancer treatment will make you maybe a little bit more immune suppressed, or in other words, in fighting the virus, but it doesn't make you more likely to get it if you follow all the good precautions. I just want to put in a plug for some natural therapies too. There's actually one called elderberry, which you can see at New Seasons and Whole Foods. Actually, Costco sells elderberry syrup, and it's called Sambuco. And there is evidence in clinical trials that reduces the virus's ability to replicate in your body. So people who are taking elderberry are able to fight off viruses more easily. So that's something that's pretty easy to do and natural, and I would suggest.
Oh, that's great. Although Costco may not be somewhere you want to go right now.
At least not early in the morning, but the line.
I know folks who have on staff who are having Costco withdrawals. Julie's last question is, if I pronounce this correctly, is neoadjuvant endocrine therapy being used as a stopgap measure for hormone positive women whose surgeries have been or might be delayed by the COVID-19 situation?
And yet the answer to that question is yes. I have to say, going into this, I actually use neoadjuvant endocrine therapy on my patients very frequently, because I often start it the day that I meet them. And that's begins treating the cancer, and also lets us know how well your cancer is responding. So it's helpful because it helps us to sometimes select people who we might have thought needed chemotherapy, but they respond really well to the endocrine therapy. So it is good treatment, and most people are going to be on it for 5 to 10 years. So you're just starting that 5 to 10 years up front. But for a lot of practices who didn't routinely do it, they are using it now to as a stopgap, as she would say, to treat the cancer, so that patients will be doing well while they're waiting for things to get better, and so that we can do more elective surgeries when we have more PPEs available.
These are great questions, Julie. Thank you for posing those to Dr. Johnson. I have one more question before we're going to go to questions that have been posed since we started this call. So just as a reminder, do put those questions in. This time is for you, that Nathalie Johnson is generously sharing with us. And I think we're getting really great information. So thank you, Dr. Johnson.
Thank you.
So the last question comes from Darlene. And Darlene's asking, how long are you immune compromised after all of your treatments?
That's a great question too. And I think it varies depending on what type of treatments you had. So for instance, if you're taking endocrine therapy, that really doesn't suppress your immune system very much at all. But obviously, if you took chemotherapy, or you're on ongoing kind of, some people with metastatic breast cancer are on something called CD4/6 inhibitors chronically, and that does impact your immune system. So coming off of chemotherapy, it takes several months really for your immune system to rebound. And for some people, it never quite gets back to what it was. But for the vast majority, within 3 to 6 months, they're pretty much their immune system has recovered. Radiation can impact the immune system some as well, but usually within 4 to 6 weeks after you've completed, you're really rebounding. So great questions.
Yeah, thank you, Darlene. So that's the questions that we had received prior to our talk starting. Alice, have we had any questions posed to the chat?
We have. We've actually had so many comments come in, just shouting your praises and telling you how much they love you, Dr. Johnson.
Oh, wow.
And then we've had some great questions. So the first one is from Marianne. She wants to know, what is your thought on the Foundation 1 test?
Okay, so the Foundation 1 is a genomic sequencing of cancers. So it helps us to look for targets that we can treat. Usually we use it for patients with metastatic cancer, if they've stopped responding to a treatment that they're currently on. So I think it's a great test to use, because it helps us to try to hone down and, I think, personalize medicine or our treatment. There's some other companies like OHSU has something called Gene Trails. There's another company called Caris DX and another one called Tempus. All of them do the same thing, sort of going through the tumor, looking for targets. And also they try to connect with research studies that may be open for somebody around the country.
Then we had another question from Anne Marie, and her comment says, I've heard that low estrogen levels are associated with worse outcomes for COVID-19 patients. Is there any truth to that? And if so, how would those of us on estrogen blockers be affected?
So I've seen some theories about that and whether women are more susceptible than men. I don't think we really know. And as the COVID develops and we learn more about it, I think we'll have better answers to that. For right now, people that are on estrogen blocking drugs, I don't think are significantly more at risk. I think just tied to having the history of cancer, there is some elevated risk if you actually got the virus. So for instance, ASCO did publish some numbers around it. And if you are perfectly healthy, then your risk of death from COVID is a little over 1%. They quoted it as 1.5%. If you have a history of cancer, it's like 3.9%. But if you've had diabetes, it's 9% risk of dying of COVID. And lung disease is 12%. So if you can see, if you have multiple things, then your risk goes higher and higher. So just the estrogen blocking drugs alone is not a super high risk factor. Hope that answers that.
Thank you. Then we had another comment from Kristen who says, should scans such as a PET scan be postponed during this time? Trying to avoid unnecessary hospital trips and not sure which types of appointments are reasonable to ask to postpone.
That's a great question, and it would depend. So if the PET scan was being done as a routine follow-up on something that was seen several months ago, but you're otherwise doing well, then I would say that's something that could wait until things have settled down. However, if there's concern that the cancer may be growing or recurrent, then that would be one that I would recommend going ahead and getting, because waiting several months for things to calm down might make a difference in outcome. So if you're not having any problems and it was a routine follow-up, then you could reschedule that. But if there's some issue, then I would go ahead and get that done. And again, going to the hospital, they're screening everyone. So it's, believe it or not, there are not a lot of people at the hospital unless they really have to be right now.
Excellent. Then we had another question from Stacy. What are your thoughts on the keto diet as it pertains to cancer patients?
That's a really interesting question as well. There is a lot emerging about the keto diet. I'm actually hoping to look at a study around the keto diet. Where I see some really exciting things is in the area of brain tumors. And it appears that being on a keto diet really reduces the risk of brain tumors like gliomas recurrence. There is some data on triple negative breast cancers and PI kinase inhibitors, that they work better if patients are on a keto diet while they're on that treatment. So there's some preliminary kind of really interesting data on keto diets, and I think more to come. So if you're, doing a keto diet, I think that during treatment, during radiation, and maybe even during chemotherapy, it may be good. I don't know that it's healthy to stay on it all the time. So you would need to take some breaks from the keto diet, but there is some evidence that in certain treatments, it can be helpful.
Great. And Allison wants to know, what is your best tip to give patients in dealing with being anxious and isolated during this time?
So one of the best tips is to actually reach out to people, because even though we're sheltering at home, you can FaceTime, with your phone, and just stay in contact with people. So it's a very good thing to do, to reach out to others. And one of the things I wanted to also say is that even though we're being asked to social distance, one of the huge important things with breast cancer survivors is getting your heart rate up at least 30 minutes 5 times a week. And that makes a big difference in risk of recurrence, and it's huge. So I'm worried about people not doing that in this time, but you can get out and take a good walk. This week, today was a beautiful example of that. Or when you're indoors, there's so many programs that you can get on your phone or video cable where they do exercises. So you should still make sure that you're doing those things. And, I think if you have one or two friends that you can really talk with and share your concerns would be awesome. And people who are into mindfulness is also really good, where you just take time to be quiet and to be aware and to calm yourself. And so there you can actually find that on YouTube. For me, I do prayer. So I also will take time in the morning and the evening to pray. And one of the best things I've heard too is to turn off the TV and just do 10 minutes of the news in the morning and 10 minutes in the evening, just enough to stay current, but try not to watch it all day long, because it is upsetting. It makes you feel off kilter. And even though it's a tough time, we're all going to get through it. And we need each other to get through it. So I'll make sure you are reaching out to others during this time.
Is Netflix an exception?
Yeah, Netflix is an exception.
Okay. We just want to clarify that.
And comedy and laughter is really good. Laughter is really good. So if you can find things that are more lighthearted, that's fantastic.
Great. We have time for a few more questions if there are, Alice.
Yeah, we have 4 more questions. So
Great.
that
Let's
might be
do
a
it.
great time to wrap it up after those. Let's see. So Lori asks, should a metastatic patient have additional biopsy or genetic testing after a period of time, or when treatments stop working? I've heard it can mutate over time.
That's a great question. And it ties back to the question on Foundation 1. So that's exactly right. When you've been on treatment for a very long time, sometimes the cancer can change in character. So doing a repeat biopsy of it and re-looking at targets. For instance, sometimes people who have had estrogen positive breast cancer for a long time, over time, it will lose that estrogen receptivity. So you need to know that. Or we can do things like Foundation 1, where we look for different targets so that we can change treatment. So yes, we usually do that. Sometimes if you don't have something that's easy to biopsy, we can do what's called liquid biopsy, where we draw blood and we can still run those tests.
Excellent, thank you. Christine asks, what are your suggestions to help fatigue that is likely a side effect from, and I apologize, I'm going to butcher this, but it says CDK 4/6 inhibitor,
Yes.
Denio, and letrozole.
Okay. No, you did pretty good.
Thank you.
So fatigue, I think sometimes is multifactorial. So it can be from treatment. One of the best things for fatigue is actually exercise. So it's kind of a catch-22. When you're tired, you don't feel like doing things, but the fact that you don't exercise actually enhances fatigue. So you may not be able to do much, but still try to get out and get some exercise, or in this time, do the little video online exercise to help you with that. Sometimes having fatigue is an underlying sign of depression. So you should check in with your doctor, or sometimes your nurse navigator. Many of the programs have that, to just see if some of it is being a little depressed. And so getting that managed helps to lift your fatigue. And sometimes just being constantly under treatment, you do get in that space. So I would suggest making sure that that's not the reason. And then sometimes we just need to look at good old-fashioned things, like you spend so much time with your cancer treatment that you haven't had your thyroid function checked in a long time. And that could be it. So it's always a good idea to check back in with your primary care doctor as well.
Awesome. And this question came from Leslie, and it's our last question in the lineup. I saved it for last because it had so many other people endorse it that I wanted it to be really impactful at the end. But she's wondering, can she sing to us at the end of the video?
Oh, of course, of course. Well, we talked about doing something uplifting and fun. So let's do, these are a few of my favorite things. Raindrops on roses and whiskers on kittens, bright copper kettles and warm woolly mittens, brown paper packages tied up with string. These are a few of my favorite things. Cream-colored ponies and crisp apple strudel, doorbells and sleigh bells and schnitzel with noodles, wild geese that fly with the moon on their wings. These are a few of my favorite things. When the dog bites, when the bee stings, when I'm feeling sad, I simply remember my favorite things, and then I don't feel so bad. Thank you.
Thank
What
you.
are, we're all giving you virtual hugs, Dr. Johnson. And we look for the time when we can hug you.
Yes.
We thank you so much for joining us this
Thank you
evening.
for inviting me.
Are so grateful for this time together, and it's for our viewers, and you are a true gift to all of us.
Thank you so much, and love to everyone. Be well.
So thank you, Nathalie. And I want to end by just sharing that we ask that you please join us next week as we explore the psychology of social distancing and the stress of living in the age of COVID-19 and the impact on breast cancer patients, specifically metastatic breast cancer patients. And we're very fortunate to have a Komen guest and colleague of Dr. Johnson, who's Dr. Valerie Correa,
Yes.
who is an oncology psychologist of legacy. So very excited to have this be our next topic. And please keep coming to the chat room to give comments. You're helping shape our future discussions. So for more information on our Health at Home series and other Komen resources for breast cancer patients, survivors, forever fighters, and the general community, please do visit our website at Komen, Oregon, all one word, KomenOregon.org, or you can call 1-800-404-8241. And with that, be safe, be well, and have a good evening, everyone, and we'll see you next week.
Bye.